So real-world utilization of guideline-based therapy. This came up earlier this morning when Dr. Petrolek mentioned these drugs are not being utilized in the community. There was a talk by Dr. Neil Shore last ASCO, which prompted our interest in this area. So the talk was about how many times, so taking a step back, the way docetaxel, abiraterone, enzalutamide, and apalutamide have improved survival in metastatic castration-sensitive prostate cancer is unprecedented. We have never seen survival improving by years in any specialty for that matter. So despite that, when Dr. Neil Shore presented the data, he showed that less than 1/3 patients in the US are getting those therapies 4 years after, 5 years after those data were presented. So let's see what we are showing, what was shown in this ASCO. So it is a 9-minute, I have 9 minutes left, and I'll go through 3 studies. So these are the 3 abstracts. And these 3 abstracts look for uses of these level 1 evidence-backed medicines, docetaxel, abiraterone, enzalutamide, and apalutamide, in patients with metastatic castration-sensitive prostate cancer in a Medicare database analysis. So Medicare database analysis had 35,000 patients. Then, and I'll show you those abstracts in a moment. Second one is presented by my colleague, Dr. Umang Swamy from Huntsman Cancer Hospital. This is from a health insurance database. So these patients were insured. So we cannot really assume that they did not have access to these cutting-edge drugs. And third was presented by Dr. Dan George. It is again in a community oncology-based setting. So it's an oncology-based setting. It's not a general world setting or general real world. So it doesn't have urology in this abstract. So let's see what we saw. So our aims and objectives were, across the 3 studies, to look at the real-world use of these cutting-edge drugs which are associated with remarkably improved survival benefit. I will skip the background. This is the first abstract presented by Dr. Steve Friedland from Cedars-Sinai, and we all had the opportunity to co-author this study. And in this study, I'll make it very simple. 35,195 patients were included, so really large study. And patients were looked at from 2009 to 2018. Data source were Medicare Part A, Medicare Part B, Medicare Part D. This was how patients were selected. More than 650,000 patients were looked at. And basically, we were looking at making sure these patients really had metastatic castration-sensitive prostate cancer, that they did not receive enzalutamide, apalutamide, or any of those drugs prior to coming on this study. And they did not receive systemic therapy 90 days prior to the diagnosis of metastatic castration-sensitive prostate cancer. So after applying all those filters, we are down to 35,000 patients. So what were the results of the study? If you look at overall results, less than 1/3 men received intensified treatment from 2009 to 2018. And then let's look at the breakdown over the years. So this also showed, so let's look at 2010 to 2014, when none of those therapies were approved. Then 2015, Dr. Sweeney had presented the docetaxel data already. So 2015, the pink color is standard ADT only, so leuprolide, Eligard, Degarelix, all those drugs. And then blue color is ADT plus bicalutamide, not enzalutamide, not apalutamide, abiraterone, or docetaxel. And then green color is ADT plus docetaxel, and then purple is ADT plus novel hormonal therapy. So we can see here, even in 2018, pink highlighted patients dominate. And if you add them to the blue highlighted patients, 78% patients in 2018 did not receive anything beyond leuprolide or ADT plus bicalutamide. Only 22% patients received novel hormonal therapies. And this was numerically smaller. The numbers were even smaller in minority patients. So those were the findings, but everyone, basically, regardless of who the patients were, where they were seen, the use of intensified ADT was occurring in less than 1/3 patients. Again, this is another way to show these data. We are showing that even in patients with visceral metastasis, we are seeing minimal use. Only a minority of patients with visceral metastasis are receiving intensified ADT. So this is a second abstract presented by Dr. Swamy in Huntsman Cancer Hospital. This was sponsored by Pfizer, Astellas. All these studies are sponsored by Pfizer, and this one was Astellas. So I'm really thankful to them for bringing up this important, for funding this important issue. So in this study, again, a very similar theme, 4,000 plus patients, insurance database. Again, I'll go through the filters, very similar filters. We were all involved in all these 3 studies, so filters were very similar. And then we look at these are the results. More than half of the patients received ADT alone. If you look at ADT plus bicalutamide, another 21% received ADT plus bicalutamide. And if you go down to novel hormonal therapy or intensified ADT, we are looking at less than 1/3 patients receiving intensified ADT. And this was, if you look at docetaxel use, that was more common in younger patients than older patients, which is expected. But if you look at the breakdown by years, even in 2019, 5 years after docetaxel data and abiraterone data were presented already by the time, apalutamide and enzalutamide were already approved by this time now, we are still seeing a very low use of novel hormonal therapy. So another way to show this, predominantly patients are receiving ADT or ADT plus bicalutamide. This is the last study presented by Dr. Dan George, and this is from an oncology, community oncology setting. So this is again similar time frame, smaller number of patients. Only difference from other studies is that the use of intensified ADT, especially docetaxel, is slightly higher in this community oncology-based setting, although the number of patients are much smaller. So this is a summary of all these 3 studies presented in ASCO by us. And the theme here is vast majority of patients are not receiving intensified ADT, which is backed by level 1 evidence. And again, as Dr. Crawford mentioned, Dr. Petrolak mentioned this morning, education, awareness, and access are going to be the key. And this is going to lead to emergence of new science, which has already existing, have been existing for a long time, but we just don't know about that. I did not know about that, at least, implementation science. So at the ASCO level, we are going to be bringing up implementation science, and hopefully at different organizations level, like how to implement. So practice-changing study. There will be a nice editorial in Journal of Urology written by Dr. Swamy, my colleague, and it will highlight the value of implementation science. Publishing in New England Journal of Medicine and getting the FDA approval is our only first and second steps. Other 8 out of 10 steps are going to happen when our patients are going to receive these treatments in real world. With that, thank you very much for your kind attention.